Medical management for increased intracranial pressure include: administer mannitol. Which of the following would be an important assessment finding for an 8-month-old infant admitted with severe diarrhea? Depressed anterior fontanelle. Bird flu is caused by virus. All are used in treating spasmodic dysmenorrhea except bromocriptine. The 5-minute upgar of a baby delivered by C-section is recorded as 9. The most likely reason for this score is cyanosis of the hands and feet. Name of the oral polio vaccine: Sabin. Size of the egg tube for a newborn infant is 2.5 mm-4 mm. The nurse prepares IM injection that is irritating to the subcutaneous tissue. Which of the following is the best action in order to prevent tracking of the medication? Use the Z-track technique. The nursing management of children with congestive cardiac failure is all the above. The Shimla Agreement was signed with Pakistan by Indira Gandhi. The best method of refuse disposal is burning. National AIDS Control Program was started in 1992. Most common malignancy in children: leukemia. Contact precautions are used in caring a patient with MRSA. When a client's skin is dry, which of the following nursing interventions would be most helpful? Limit bathing to once or twice a week. Application of the drug directly to the skin is known as inunction. Tissue in the urinary bladder called transitional epithelium is best described in which of the following ways? Change shape depending on the bladder's fullness. Undescended testes is termed as cryptorchidism. It is a transparent membrane that focuses the light that enters the eyes to the retina. Cornea. The volume of air that moves in and out of lungs with each respiration is tidal volume. As a routine, all newborn are given an intramuscular dose of vitamin K. Physical regulation of the body temperature by loss of heat is metabolism. When should one drink ORS? During diarrhea. When giving a client a diagnosis of acute pain, the nurse using Nanda diagnostic categories will use this diagnosis only when the pain lasts no longer than which of the following lengths of time? 6 months. The commonest form of dementia is Alzheimer's disease. First most common type of cancer in females in India? Cervical cancer. The physician of your assigned client tells you that the client has a heart murmur that can be detected by direct auscultation. You realize that the physician is telling you which of the following things? Use of a stethoscope is necessary to hear the murmur. Balwadi nutrition program was started in 1970. A dull percussion is noted over the symphysis pubis. It may indicate distended bladder. Which of the following drugs is used to control nausea and vomiting? Promethazine. Patot syndrome is trisomy 13. Paracetamol medicine is antipyretic. Personal data in the medical record is owned by next of kin. Which of the following words represents the basic unit of all life and is the simplest structure that possesses all the characteristics of life: organization, metabolism, responsiveness, homeostasis, growth, and reproduction? The cell. Pulse pressure is a difference between systolic and diastolic pressure. The respiration is carried on by lungs. The most important and frequent mode of transmission of nosocomial infection is contact transmission. Ethics means study of human concepts. Vector of dengue fever. Aedes aegypti. The nurse teaches the client how to instill nasal drops. Which of the following techniques are correct? The client blows the nose gently before instilling drops. If a client says, "God is punishing me" or "Why me?" how should the nurse aide respond? Listen quietly. Meconium is first stool of a newborn. Which of the following testicular tumor is most radiosensitive? Seminoma. Sterilization by steam under pressure is carried at the temperature between 108 C and 147 C. Postpartum IUCD is inserted within 10 mTs of placental expulsion. KMC should be continued for a neonate born preterm till baby achieves 3500 gm weight. When teaching someone about endocrine glands, which of the following statements could you use? Hormones are carried away from the endocrine gland by the blood. Skic test can be done in case of diphtheria. Which of the following is a polyunsaturated fatty acid, PUFA? Inolic acid. Which of the following immunoglobulin are responsible for anaphylactic reactions? IgA. The quantitative researchers gather empirical evidence. Which of the following cluster of data belong to Maslow's hierarchy of needs? All of the above. Please like and subscribe to my channel and click the bell icon to get video updates.